Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. All right, Christine, what's going on with your feet? What happened?
Having pain on my right foot,
Mm-hmm. How long this been going on?
maybe on and off 1 or 2 months, but the pain now is like 2 weeks
2 weeks.
continuously.
So can you show me where do you feel the pain?
Um, more of here and here on the toes.
In the toes and there. And when do you feel the pain? Is it like early in the morning when you sit for a long time? When do you start feeling the pain?
At rest
Okay.
mostly.
At rest.
And in the morning.
So the first few steps.
Yes.
Do you feel you're stepping on ice or glass or stepping?
More of glass.
Okay. So how long you been having this plantar fasciitis?
I don't know how long, but the symptoms of it,
Uh-huh.
maybe a month.
A month.
But the
Okay.
pain is more of over like this past few 2 weeks.
Okay. So currently, how much pain from 0 to 10 when you step on it?
Oh, 9.
9. Okay, that's the first few steps. And it start to calm down?
Mm,
Or it's a consistent?
it's a consistent every morning when I first step. Yeah. And at rest, it would throb.
It would throb. Resting, okay. And what kind of treatment you had for your plantar fasciitis?
Right now, I'm just taking a pain reliever that was prescribed by the doctor.
Okay,
And ice and the ball, tennis ball.
okay. Did you had any treatment, like massage or anything?
Yeah, I had just the one time after
Okay.
the urgent care.
You went
I
to the
couldn't-
urgent care? Okay.
Yeah, after urgent care and I couldn't really walk.
Mm-hmm.
I went to a reflexologist for my
Mhm.
foot, and maybe it helped me relieve a lot.
Mm-hmm. Do you still feel pain?
Yeah.
Okay. So let's stimulate the pain now, okay? And I want you to let me know how much pain from 0 to 10 with walking.
Okay.
And then we're gonna do the same thing after the treatment.
Okay.
Okay. So you're really limping here.
Yeah.
Okay. And you tell me how much pain.
Same 5.
And you feel it in the ball of your feet.
Yeah, and on
Okay.
the sides
And it's on the right side.
yeah.
And before this, you did not limp like this.
No, not this bad.
Okay.
I can still like level it out
Mm-hmm.
before, but
Yeah, you're very slow here too. Okay. Sorry. Don't kick me, okay?
no.
Alright. Alright. So that's painful?
It was just like a stab.
Is that, what about here? Here too?
No.
No? Okay. Here? Man, you're really tight here. Feel that?
Told you.
Yeah. Yeah, the whole calf is really tight, and especially here. Do you wear high heels?
No. I can't even wear high heels.
Yeah, that's will actually cause a lot of issue too. The high heels. Okay, so I'm gonna give you injection, okay?
Oh my god, seriously?
Not really, okay. I'm glad you're still awake, okay? Just want to make sure. No. It's just, you're gonna feel a little bit pressure, okay?
Okay.
So, when you walk, I was seeing you, actually your weight on this side.
Yes.
Yeah, you have very high arch.
Mm-hmm.
And your pain in here, yeah?
Yes.
Okay. Alright, so make sure this is not painful. And no kicking, okay? How's that?
It's good.
Okay.
There's a little pain, but not
Sorry,
that
what
bad.
about now? I decrease the pressure. How about now?
No.
No pain? Okay, that's good. Make sure it's not painful. So in the morning, so throughout the day you're limping like that.
Correct.
But your pain worse the first few steps, but it's constant after that.
Yes.
Is that correct? Okay.
Oh, that hurt.
Sorry. So how did you hurt yourself? Like, did you do a lot of walking or anything?
I really have no idea what
Yeah.
I had that. Maybe because I work 12 hours a week. And
You what?
Works too much hours.
Oh, I thought you were 12 hours a week. I'm like, yeah, it's a lot.
day.
Yeah, you stand on your feet a lot.
Yeah,
Yeah, that's.
because I'm overweight.
Make sure it's not too much. How's that?
It's okay.
Okay. Sorry.
When you squeeze like this,
Here,
side
like
by
this.
side,
Yeah.
that's when it hurts.
Okay. I'm trying to pull pressure this way.
Okay.
Okay. I'm not gonna squeeze it. Okay. I just wanna know. I'm palpating now to know where to release.
Okay.
Okay. Okay, let me work on this. This is really tight. Okay, let me know if this is too much, okay?
Okay. Nothing.
Okay, that's good. Sorry. There you go, see? How's that?
1 to 10 will be 6.
So that's, make sure it's not painful what I'm doing.
Yeah,
Ah,
make sure
okay.
it's
Just make sure you tell me,
All right.
because there's fine line between releasing and breaking scar tissue and causing scar tissue.
Okay. That's
So if you feel more pain, that's like causing trauma to the healthy tissue. We don't want that, okay?
okay.
Sure. Tender here?
Yes.
What about when I do this? How's that?
It's okay.
How's that?
That's okay.
Okay. Okay, get it. What's happened?
Ow, that hurt.
Sorry. Okay. So your whole thing, your whole calf is sensitive, isn't it?
Yeah.
What about now? Oh wow. You're really inflamed there. What about here? You feel this knot here? Your bum?
I feel it numb, but I don't. I
Yeah.
just feel something scraping, but not pain.
Yeah, sorry. Is it painful here? It's okay.
Oh yeah.
Yeah, you're very sensitive here. Huh. What about here?
No, it just tickles.
That's okay, it's fun to be here. Okay. Do you want to feel the scar tissue?
Mhm.
Yes or no?
No.
Yeah.
Okay. But you feel it, yeah?
Yeah.
You feel this bump here?
Yeah.
Okay. Here?
Yes.
That's like, she has rocks everywhere here. Okay. You're gonna be gentle, but make sure it's not painful.
Okay.
Uh,
Ow.
pain?
Yeah.
Wow, okay. What about here?
No, it just tickles.
Okay, that's fine. What about here?
No.
Feel this here?
No.
This bump? I don't want to like really go deep, so because he's sensitive. Yeah, so if you have inflammation like this, make sure you communicate with me, so I will take it easy in that area, okay?
Sorry.
That's okay. Well, I'm gonna use other stuff.
That hurt.
Really? This is the pressure I'm doing. Like this.
Wow.
Yeah. She's very inflamed. You have a lot of inflammation, that's why you're not tolerating that. So we're gonna do other stuff and we'll work a little bit more on the inflammation. Too much what I'm doing here?
No.
Okay. Tell me, okay?
Mm-hmm.
How's that?
It's okay. Ow.
Sorry. I'm trying to
Why are
sneak
you
in
laughing at me?
and go slowly. See how far I can go. Okay. Or I'm not taking this. Okay. How's this?
It's okay.
Okay. Do you feel sensitive here?
Mm-mm.
Here.
No.
It's not like this.
No, that's like bone.
That's exact pressure that I applied here, like here.
Oh.
But because you have a little bit inflammation here, it feels like very sensitive. Too much?
You know, maybe I should ask my mother
Mm-hmm.
for the history, because she mentioned to me before that when I was a kid I had to wear orthotic braces shoes
Why?
because it was like this.
Oh, you had two then?
I don't know what it's called, but my feet
Club
are both.
foot?
No, it's not club. Club is like this.
Yeah.
My grandma on my dad's side had club foot,
Uh-huh.
so when I was born, my feet was like this.
So,
So I needed to have like training shoes.
yeah, to correct it.
To correct it, and they did correct it, but I don't know when I, get older,
So,
what
yeah,
happens.
ask her.
Yeah.
Yeah. Yeah. You definitely have like more than normal arch,
Yeah.
and that's could be a risk factor for plantar fasciitis. Your weight is too much outside.
Mhm.
That's your weight should be distributed in 3 point here, here, and here.
Yeah.
But most of your weight when you were walking it
Right.
was outside.
Mhm.
So I'm gonna work on that, and I'm gonna give you exercise. Okay, so okay. How's this feel here?
That's okay.
Yeah, that's the same pressure. Okay. Let's do a couple of things here. Do you have water? I will give you some water here. Okay. Sorry. Okay. All right. 0 to 10.
Nothing.
Okay.
Zero. It's 0, but I'm like still like,
Imbalance.
yeah. But
What's-
at least I feel like my whole feet is like grabbing on the floor and not like.
Not like
curved.
twisted.
Yeah.
Okay, let's walk a couple of times. So just back and forth. Oops, sorry. Wow. How's that? You're not. You're walking much better actually.
Yeah, and
You're not
faster,
limping. Yeah.
but it's just painful still on my toes here,
How much? Like in the let me see it again.
like towards the end here,
Okay, not the metatarsal. Okay, how much?
like maybe 3 or 4.
Okay, so we're gonna work on that. But you're grabbing on the
Yeah.
floor. You're not limping. That's
Yeah.
beautiful. Okay, so let's lie on. Let's lie on your stomach again. third and fourth. Okay, right here. Yes?
Mhm.
Okay. How's that?
Okay.
Make sure it's not painful.
Ow. Ow. Ow.
Sorry.
Ow.
Okay. I gotta give you something for inflammation after this. I'm basically like barely touching. Okay, let's do this. What do you like to do? Okay, what do you like to eat? Just healthy stuff, okay? Or you can say ice cream, that's fine, okay? I'm gonna edit this.
Healthy, I don't know.
Okay, let's
Can't
skip
think
that.
of any.
Let's skip that question, okay? So think about something you like to do other than food.
Swimming.
Swimming, okay, that sounds good, okay. So, swimming, what else? Ocean or like in the pool?
The pool.
The pool, okay, that's nice. How often do you do that?
Not as often anymore.
Okay, that's a good exercise. You can start doing that. It's nice weather actually now.
Yeah, but when I
It's
put
cool.
on my goggles and I see all the dirt, it just disgusts me. So I
It
stop.
depends on the
The
pool.
pool.
Yes.
Okay, let's not go to that pool again. Yeah, and I hope they have a bathrooms there. Not a public pool. Yeah. Okay, other than the pool, what else?
Snorkeling.
Oh, nice. Yeah. When the last time did you do that?
Last year when I went back home to Philippines.
Nice. It's beautiful there, isn't it?
Yep.
Yeah, that's beautiful. What else do you like to do?
Gardening.
That's nice. Do you like plant your food or you just flowers?
More of like herbs.
Herbs, nice. What you do? What you plant?
Well, basil, oregano.
Mm-hmm. How is the basil? I actually doing it like I'm planting oregano and rosemary. How is the basil doing?
Well, right now I stopped, but before when I used to do the oregano is already faster to grow.
Really?
As
How
long
long?
as with sun.
Okay, mine is like I started like 3 months ago. 2 months ago. It takes a year or something like that.
Maybe.
Or maybe mine is special. So basil.
But they have the indoors now, right?
Really?
The
Oregano
indoor-
and basil?
I mean, like for any herb growing. They
Well,
have this,
so-
like,
I think some of them need sunlight to
Yeah.
grow. You know, there's probably some indoor stuff, but the ones that need sun, it's grows usually fast in the sun. Yeah. So basil, what else? You cannot beat the fresh herbs, you know, not like the one in the can, and not in the
I
can, in the
know.
bottle.
Yeah.
Is that too much?
No. Good.
Okay, what else do you like to do?
Ow!
Okay,
Sorry.
that's okay. Not able to distract her. Just
Yeah.
focus on the question.
I'm trying, but
Okay.
my brain is like focusing on what you're touching.
Okay, let's go back to the food. Okay,
Come back to the food.
let's go back to the ice cream. Yeah. Is that too much?
No, it's okay.
Okay. Have you tried like tomato or something like that?
No.
Yeah, it's nice.
Tomato and eggplant.
Yeah, yeah. I
I've
have.
seen this on TV, the
It's-
inverted
Mhm.
tomato planter.
Mhm.
I don't know if those works.
Yeah, I have it in the backyard. It's cherry tomatoes. It's really.
Really good.
Oh yeah, especially when it's fresh. It's just it.
Tired.
Well, tired. Like you're laying down and you're tired.
Yeah, we're talking about food, so. All right, so let's stand up and tell me how you feel.
Still a little pain when I stretch like this.
What you do? Okay, let me see it. Turn around and do it. How much from 0 to 10?
5.
Where?
Okay, I need to hold on to.
Okay.
Okay, it's like right in the arch and right in the arch around here and in here.
Okay. So you feel 5 there when you stretch it.
Go like this.
Overstretch. What about walking?
Walking.
Just normal walking. I want to see how you walk.
Walking is okay. It's a little tight, but it's good.
Okay, because that's what we tested before.
Yeah.
What you do is overstretch. I expect you're gonna feel tightness, but if you feel pain, just let me know. I'm gonna work on it. You have a lot of scar tissue and you have inflammation, so I'm doing something different because your inflammation is high. So when you overstretch, you feel it.
Yeah.
Okay.
Like right now, I'm putting my full weight on my right,
Mm-hmm.
and I feel a lot of tightness on this side,
Okay.
but it's not painful.
It's not painful. Okay. Let's actually get in this. Lie on your back. As long as you don't feel pain, that's fine. But we're gonna work on the tightness more when the inflammation comes down, and I will give you several things we can do too for the inflammation after the video. Is that too much?
No.
Okay. Too much here?
Ow.
Sorry. Okay, let's back to the. So food.
Food.
Yeah.
That's
What's your favorite meal?
There's no such thing as favorite because I love everything.
Everything. Just bring everything, and I'll be happy with that. Yeah.
You eat pork? No.
Health-wise, no.
No.
Because for health-wise, I used to eat it, but when I realize it's not the best,
Meat. Yeah.
meat. It's better if you eat organic chicken or grass-fed beef, but
Yeah.
beef, be gentle with that. How's that?
It's good. It's better.
How's this?
It's like no pain at all on my toes when I walk.
That's good. You stretching it. Yeah, beautiful.
No, that I can't do yet.
What you try to do? No, you cannot do heel raises now.
Oh.
You're not ready for that.
Okay, I'm just like
Like
stretching.
the walking. I don't want to stretches because actually stretches is not good. I'm gonna give you other exercises. When you have a scar tissue and fascia restrictions, your stretches is actually gonna make it more inflamed.
Okay.
So, and actually studies not showing stretching provide long term. So yeah, we're gonna do more stuff.
I don't feel like compensating on my left.
Yeah,
anymore.
let's walk back and forth a couple of times. Yeah. Oh,
Careful.
sorry. Ooh, there you go. Technical difficulty. Yeah.
There's a little pain, but bearable pain.
How much from 0 to 10?
Like 2
Where?
here. I can't really point it out where.
So you feel it here?
Correct.
Yeah. Okay. Oops. There you go. Made a mess here. I hope you guys not seeing that. Okay. You don't did it, not me. It just was my hand. Relax.
Okay.
Okay. Too much? So it's right in here, yeah?
Mm-hmm.
Okay. Yeah, let's go back to food, okay? Try to distract her so I can do some more work here. Yeah. So what do you like to bake?
Bake.
Other than cookies?
Other than cooking? No, I don't bake.
Cooking, cookies.
Cookies, I don't bake.
Yeah.
I'm a bad baker. He's a good one.
Oh, wow. That's good.
I'm the cook.
Nice.
He's my chef, my
Yeah,
personal
that's
chef.
nice.
When I'm tired and can't think of any more menus, I'm like, babe, your turn.
Yeah, that's good. You guys help each other. Is that too much? You will start because you have not used certain muscle proper way. You're gonna start feeling you're doing some work.
Right.
That's normal.
Okay.
Okay. because you were actually, your weight was on the outside, you were limping, so you did not use a lot of muscle properly. So if you feel like a kind of workout, that's okay, but don't push it.
Right.
Just gradually walk a little bit, listen to your body. If you feel tired, fatigued, just sit, do it more frequent. Okay, let's try it. How's that?
It's good. Just,
You feel normal now?
yeah, feel normal.
Mhm.
Normal.
Yeah.
Yeah, that's
Play
beautiful.
golf, babe. Finally.
You want to golf?
Yeah.
That's nice. Yeah, why not?
We
Gonna-
used to, but we stopped.
Yeah.
We're married to both our work.
Oh, wow. Well, you guys can do that in the weekend, you know?
Yeah.
Yeah, yeah.
Yeah,
fun.
sometimes at work weekends.
Yeah. Well, the weather is nice here.
Yeah.
You can take advantage of that anytime.
It's
How-
good. I feel good.
Good. Okay, so what do you think about ASTR treatment? Which is what we worked on in a few minutes here.
I don't know what's the word.
Mm-hmm.
It's amazing, I guess.
Yeah.
Because I don't have to like go through take some medicine.
Mm-hmm. It's
but
natural.
Natural
Yeah.
therapy.
Mm-hmm.
Not painful.
It's painful, but it's a good kind of pain.
Well, I want to make sure it's not painful. You make sure you communicate with me. We don't want to cause the pain.
Okay.
You know, that's very important part of the treatment. We don't want to cause pain.
Okay. So, but yeah, I feel like a normal person.
All right, awesome. Thank you. Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.